Hello everyone, my name is Neha Thakur and the topic of my discussion for diagnosis of decade presentation is women's health before, during and after childbirth, and decade I'm going to discuss is 2000. A brief background, as you all know by now, that 2080s was the time when there were a lot of concern about the lower birth weight of infants, and there were a lot of recommendations about the nutritional diet of women. There were development of prenatal vitamins and also the initiation of WIC program. Moving on to 1990s, they were concerned about the maternal deaths because there was alarmingly increase in maternal deaths. CDC's division of reproductive health, it found that the maternal deaths were not just within one week, but it could be within 1 year due to specifically gestational diabetes and also preeclampsia, because these are the conditions which develop a lot of physiological changes within the woman, and which could lead to maternal death for maybe not instantly after childbirth within 1 week, but it could have a slow impact, and the woman could die within 1 year due to related infection or complications of health. AHRQ also developed some recommendations about how the weight of a woman before, during, and after a childbirth has impact on that maternal death rate, and most specifically the weight retention after childbirth is one of the major reason why maternal deaths are so high. But in early 2000, that recommendation was considered as inapplicable because it had ignored the other conditions that those pregnant women were having, and also the sample size of that study done by HRQ was really small. Because there was so much awareness about the nutritional diet and about all the complications due to weight retention, that women become very conscious about their weight and about their nutrition and about their diet. The 2000, I can say, was the phase where there were a lot of decrease. There was tremendous decrease in maternal and infant deaths. Also, I would like to give credit to WHO, because WHO involved maternal deaths or maternal care as one of the MDGs, that is the Millennium Development Goals, and it gave a lot of recommendations about how the pregnant woman need care during pregnancy, and a skilled care during childbirth, and also a support weeks and weeks after childbirth, which can help her maintain the healthy birth weight after pregnancy. It also had recommended about all the birth related procedures to be done by the skilled professional and not by untrained, including abortions. Everything has to be done by the skilled professionals. That did show a lot of reduction in maternal deaths. Besides this, WHO also recommended a lot of ways in which the known reasons of maternal deaths, like severe bleeding after childbirth, could be avoided by injecting women with oxytocins, and puerperal fever can be avoided by maintaining good hygiene and sanitization of equipments. Gestational diabetes could be prevented by doing the glucose screening test. Initially, it was done for women who had the history of diabetes or have somebody or diabetic patient in the family, but later on that was done by they made it mandatory for all the pregnant women, which helped in further decreasing the maternal deaths. And preeclampsia, they recommended monitoring the blood pressure of pregnant women throughout the pregnancy, and also the urine test for protein, because this could help in early diagnosis of preeclampsia, which helps in early diagnosis and prevention of preeclampsia converting into eclampsia, which causes seizure-like activities in women and could cause the organ failure and later death of women. So overall 2000 had a positive note, but I do want to mention 2000 there were a lot of maternal deaths due to HIV. Some of the global authors, they consider HIV as the epidemic or pandemic in different parts of the world, but luckily in USA it was under control. But there were a lot of HIV related deaths, and also HIV being transferable to infants, what made it more complicated. But I think after 2005 there was a certain decrease in HIV related deaths as well. So overall 2000 was a positive decade, and I think they learned a lot, and they implemented a lot of recommendations, the positive recommendations, which caused the positive result. Thank you.